Hello everyone and welcome back. My name is Dr. Ben Osevwe. Today we are going to talk about social anxiety disorder, also called social phobia. This lesson is for PMHNPs, students, parents, and anyone wanting to understand social anxiety practically. By the end of this video, you should be able to explain social anxiety disorder and its neurological roots. We will also cover treatment options and nutritional supports that may help the nervous system. Short disclaimer. This video is for education only. It is not medical advice, diagnosis, or treatment. If someone has suicidal thoughts or feels unsafe, call or text 988 for the Suicide and Crisis Lifeline. Part 1. What is social anxiety disorder? It is a mental health condition of intense fear. It is the fear of being judged, rejected, or humiliated in social situations. A simple way to explain it is this. Social anxiety disorder happens when the brain treats social situations like danger. Everyone feels shy sometimes, but social anxiety disorder is different. The fear is stronger and lasts longer. It can interfere with school, work, relationships, or even simple tasks like eating in public. Part 2. What social anxiety can look like. It shows up in the body, thoughts, and behaviors. Body symptoms may include a fast heartbeat, sweating, shaking, blushing, or an upset stomach. The mind may say, everyone is watching me, or I will embarrass myself. It's a fear of being judged. Behavior symptoms include avoiding eye contact, speaking quietly, or staying away from social events entirely. Part 3. Social anxiety versus shyness. Shyness is a trait, but SAD is more intense. A shy student may feel nervous raising their hand, but they can usually warm up over time. A student with social anxiety may avoid school or never ask for help even when they are failing. A simple explanation. Shyness may make something uncomfortable. Social anxiety can make it feel impossible. Part 4. Neurological root causes. What happens in the brain? It involves the brain's fear system. The amygdala is the part of the brain that helps detect danger. Think of it like a smoke alarm. In SAD, the amygdala may become extra sensitive to facial expressions, silence, or attention from others. The prefrontal cortex is the wise coach that helps with reasoning and calming emotional reactions. When anxiety is high, the alarm bell becomes so loud that the wise coach becomes hard to hear. When the brain thinks danger is present, the body prepares to survive. Heart beats faster, muscles tighten. A simple way to explain it. The body prepares for a tiger, but the person is only walking into a classroom. Several brain chemicals are involved. Serotonin helps regulate mood, and GABA helps calm the brain. Social anxiety is usually a network issue involving fear, attention, memory, and learned avoidance. Part 5. Psychological root causes and patterns. These are thoughts and habits that keep SAD going. Fear of negative evaluation is a huge root. People fear being judged badly or rejecting. Mind reading means assuming you know what others think, turning small social cues into scary stories. The spotlight effect makes you feel everyone is watching. Anxiety tells you that you're on stage. Avoidance brings short-term relief, but it teaches the brain that the situation is dangerous, making SAD stronger. Safety behaviors like rehearsing every sentence or avoiding eye contact also keep the anxiety alive. Part 6. Social root causes. This is also shaped by a person's environment and experiences. Bullying, rejection, or constant criticism can increase social anxiety, teaching the brain that people are unsafe. Social media can increase fear of judgment as people compare themselves to edited, filtered, perfect lives. Part 7. Medical and diagnostic considerations. PMHNPs should assess carefully as SAD can overlap. Social anxiety can overlap with autism, ADHD, PTSD, or even medical causes of sweating and tremors. Part 8. Treatment options. The good news is that social anxiety disorder is treatable. CBT is the gold standard psychotherapy. It helps people learn new ways of thinking and reacting. Exposure therapy helps you gradually face social fears. The goal is to learn, I can feel anxious and still do this. Medications like SSRIs or beta blockers can also help, especially for moderate to severe symptoms. Part 9. Nutrition and vitamins. Food and vitamins support the nervous system, but they don't replace treatment. Supportive nutrients include magnesium, vitamin D, B vitamins, and omega-3 fatty acids for brain health. Tell patients, social anxiety is a false alarm around judgment. The goal is to stop fear from controlling your choices. Social anxiety becomes urgent if it leads to severe depression, substance use, or suicidal thoughts. Call 988. Today we learned that SAD is a real treatable mental health condition. Confidence grows from practice. I am Dr. Ben Osevwe. Thank you for watching, and remember, with support, social fear does not have to control your life.